Hi all, today I am going to talk in brief about cephalocaudal growth. Cephalocaudal growth is a developmental pattern in which growth proceeds from head, that is the cephalic region, to the feet, that is the caudal region. In orthodontics, this concept helps us understand the timing and sequence of craniofacial growth. In fetal life, head constitutes about 50% and limb constitutes about 30%. At birth, head constitutes about 30 to 50% and increased growth of body and limbs. In adults, head constitutes about 12% and limb constitutes about 50%. Cephalocaudal growth of craniofacial region. At birth, the jaws and face are less developed when compared to skull. Structures closer to the cranium matures earlier than those further away. Maxilla, being closer to the cranium, grows faster and completes its growth before the growth of mandible. Mandible, being away from the brain, grows more and growth completes later than maxilla. Orthodontic significance. Timing of treatment. Growth modification treatment are planned accordingly. Management of skeletal malocclusion. Since mandibular growth continues, some skeletal discrepancies may improve or worsen with growth. Retention and stability. Mandibular growth after the treatment may affect the long-term retention and stability. So, cephalocaudal growth is a key principle in orthodontics. It explains why craniofacial structures grow at different rates and helps orthodontists determine best thing and approach for treatment, especially in growing patients. Thank you.